Hey, thank you so much for joining us. It's always exciting to talk to you. You've got intelligent things to say and a great attitude, and those are rare combinations. It's really nice. I'd love to just start off big and ask you to sort of give us kind of your state of the industry, talking about interconnectivity, DCT, where you see things right now, and we can drill down a little bit.
Yeah, no, thanks for having me. It's always good to reconnect with you, and it's always a great time having a chat with you. So I'm excited to be a part of this program. As far as the state of the industry, let's rewind the clocks a little bit. The last 3 years have been interesting, right? I mean, we had COVID throw a wrench into our daily lives, into business, and all the. One of the things that I'm beginning to see is it's a growing dependency that we have on technology, and what we've done with our technology implementations is that the consumers of that technology has gotten, massive now. I spent the last decade at Exostar working with, the big guys on consolidating technology, making it easier, putting it at the fingertips of a lot of their constituents, right? The sites. We're starting to see that grow now beyond the sites and go directly to the patient, right? So, one of the things that I really started seeing over the last 3 years with COVID is now the dependency to make things more user-centric, patient-centric, because, a lot of it was about site centricity. Now we got to get to patient centricity. A lot of big words out there, but what does that really mean, right? And, as I think through really what I'm starting to see now, it's how do we incorporate patients into a heavily regulated industry, into a heavily regulated process, and put technology and almost dumb it down a little bit to make it accessible to the average Joe that's now enrolled into a clinical trial.
I know a big issue for you, and it plays into this. I'd love you to talk about this, is data interoperability. You
Oh,
know, that's the bugaboo, right? That's it, and without it, you're not using your data. You're definitely not, at the top of your game. So talk about where we are with that and where we maybe need to be.
man, we still have a problem with that industry wide. And I think part of it is a very organic thing. A little bit of a history lesson. I'm beginning to date myself a little bit. My career actually began in the advent of EMRs, right? Finding a way to get away from paper charts to manage a patient's health record, right? And one of the things that I started seeing a lot of was, the different systems that were out there, the changes in clinical workflow. So when we talk about implementing technology at the clinical level to manage a patient's care, in very, very many ways, it's still not quite where it needs to be. And back in that day, when it was government funded, when there was a carrot and a stick approach, where the government was funding a healthcare provider and their adoption or implementation of electronic medical records, one of the things that shocked me was the fact that the government had to take a carrot and stick approach. We were giving $44,000 to a clinician that had upgraded and demonstrated what we call meaningful use of an electronic medical record system. And, back in the old days before the major consolidation happened in health IT, there were a lot of different EMRs competing for business, right? Everybody started to take a different approach from a technology perspective by trying to make theirs a little bit better. And it was very much an HD DVD versus Blu-ray type battle. Let's play that out now with all the different systems that do different things in clinical research. Everybody has their own IP. Everybody has their own system that performs a specific function. I've got an electronic data capture system. I've got my own, I have a different system to randomize, right? I've got a central lab system that sits over here. In short, we're so dependent on the different systems that are used to conduct research. What it leads to is duplicate data entry, right? I've got to enter, the vital signs in this system. I've got to enter, lab results here. I have to enter the patient demographics here. All of that information being scattered across different systems is contributing to a lot of physician fatigue, right? When it comes to technology, as if they weren't burdened enough with, the implementation or adoption of an EMR.
Before I let you go, this is great stuff and it's encouraging. But so I've been talking to a lot of people over the last couple of months. We're 2023, early days of 2023 right now. Some people maybe optimistically are saying, this could be the year of the site or the season of the site. Do you think, this is sort of a broad question, but do you think sites need a louder voice at the table? And do you see that happening in terms of the communication with sponsors and everyone else?
I do think so. And because the shift in attention is now more centered around the patient, sometimes the sites get caught in between going, hey, where do we sit, right? And the reality of it is you'll never get away from a site. You'll never truly, conduct your trials, directly with a patient anymore. Number one, the sponsors don't have the bandwidth for that. A, B, technology, because of the regulations, because of the regulated environment when it comes to compliance and things like that, and it's too much of a gamble to try to just take technology and throw it directly to a patient. One of the things that we start to see in a lot of oncology studies is that a lot of these folks don't enroll into studies until they're in it's a terminal condition, right? That's when we begin to say, hey, look, because that's where hope comes into play. The notion of research has become so daunting. You really need that intermediary, that site, that hospital to facilitate a lot of those discussions, right? As we begin to look at growing diversity in participants in studies, you can't always rely on those folks that are at the later stage of whatever that diagnosis is to try to enroll them into a study. We need folks we need to lower that barrier and get more folks involved. And sponsors, frankly, don't have the bandwidth. We saw the outsourcing movement with the rise of CROs, right? Sponsors depend on strong partners that can handle the day-to-day pieces, and the sites very much sit in that middle space there. So I do think that sites need a voice. They will always have a place at the table. I think sites need to remember that too. And sponsors, as they begin to roll out technology, yes, it's important to keep the focus on patients now, but we can't forget about the sites in between.
Fantastic. Kenny, Kong, thank you so much for joining us, and keep fighting the good fight. You're doing some good stuff out there.
It's always a pleasure, man. Thank you very much, Mike.